Assalamu alaikum. So our topic for today is rectus sheath. Before starting and discussing about what is rectus sheath, let us first have a quick recap about the muscles of the interior abdominal wall. As we know that the muscles of interior abdominal wall are divided into two groups, the lateral group and the anterior group. The lateral group, as we know, also known as the flat muscle group, and the anterior group also known as the strap muscle group. The lateral group comprises of three muscles known as external oblique, internal oblique, and transversus abdominis. The two muscles of the anterior group are as rectus abdominis and the pyramidalis, which is an accessory muscle present behind the rectus abdominis near the pubic tubercle. The rectus abdominis, which is a long strap-like muscle extending from the xiphoid process and costal margin of 5th to 7th rib up to the pubic symphysis, is divided by a tendinous band known as the linea alba. The linea alba is a fibrous band that separates the rectus abdominis into two halves. The curved margin of the rectus abdominis, the lateral curved margin of the rectus abdominis is known as the linea semilunaris. Linea semilunaris, which is the lateral curved margin of the rectus abdominis. The rectus abdominis is divided into distinct segments by fibrous bands or intersections known as tendinous intersection that divides the rectus abdominis into distinct segments. The rectus abdominis consists of vertical fibers. These fibers are divided into distinct segments by the tendinous intersection. What is linea alba? Linea alba is the fibrous band that divide the rectus abdominis into two halves, and the lateral curved margin of the rectus abdominis is known as the linea semilunaris. The rectus abdominis is covered by the aponeuroses of the lateral muscle group. The aponeurotic part of the lateral muscle group covers the rectus abdominis, which forms a thin sheet which we know as rectus sheath. So, what is rectus sheath? It is the thin envelope formed by the lateral muscle group that covers or surrounds the rectus abdominis. The rectus sheath is considered at three levels. Level 1, above the costal margin. Above the costal margin. Second, between the costal margin and pubic symphysis, and third, below the arcuate line. Below the arcuate line. Before going into these three levels, let us first clear out what do we mean by costal margin and what do we mean by arcuate line. So, what is costal margin? As you can see here, it is our thoracic cage. Sorry for drawing it so badly, but just for the reference, consider this is our thoracic cage. So, the lower border, this is the lower border. The lower curved edge of the thoracic cage, which is formed by the cartilages of 7th to 10th rib, is known as the costal margin. It is an imaginary line which is formed by the cartilages of 7th to 10th rib. So it is the lower edge. What is costal margin? The lower curved edge of thoracic cage formed by the costal cartilages of 7th to 10th rib is known as the costal margin. So now let's get on to the arcuate line. What is arcuate line? What do we mean by the arcuate line? So the posterior lamina of the rectus sheath ends halfway between the level of umbilicus and pubic symphysis. The line where this lamina moves forward or ends is known as the arcuate line. I'll further show you in a diagram, but for the reference, but just to have a basic idea right now, this is, let's consider this is your posterior lamina of the rectus sheath and this is your anterior lamina of the rectus sheath. In between this we have our rectus muscle moving down and attaching on the pubic symphysis. This is a rectus muscle, the posterior lamina and the anterior lamina. So the line where this posterior lamina of the rectus sheath moves in front, this line or the site where this posterior lamina moves in front or ends is known as the arcuate line, and it ends somewhat between halfway between the umbilicus and pubic symphysis. So the arcuate line is found halfway between the umbilicus. Here it is our umbilicus and it is our pubic symphysis. So somewhat halfway between the umbilicus and pubic symphysis, the arcuate line is present, and which indicates that the posterior lamina of the rectus sheath has ended or has moved anteriorly. The arcuate line is also the site where the inferior epigastric vessels enters the rectus sheath. The arcuate line is also the site where the inferior epigastric vessels also enter the rectus sheath, and it is also an important surgical landmark. The arcuate line is considered as the site of weakness in abdominal wall. Now let's move on to discussing the three levels of the rectus sheath, starting with the first, above the costal margin. Now we are clear with the concept. What is the costal margin? The lower curved edge of the thoracic cage, which is formed by the costal cartilages of 7th to 10th rib, is known as the costal margin. So now considering the our first level above the costal margin, as you can see here in this diagram, that the rectus sheath is only present anteriorly. It only has the anterior lamina, whereas the posterior wall is formed by the 5th, 6th and 7th rib. The rectus sheath is only present anteriorly, covering the rectus abdominis muscle, and the posterior wall is being formed by the 5th, 6th and 7th rib. Moving on to the next level, level 2, which is between costal margin and pubic symphysis. Here at this level, the Aponeurosis of internal oblique. The aponeurosis of internal oblique splits into two and forms cover the rectus abdominis anteriorly as well as posteriorly, forming two laminas, the anterior lamina and the posterior lamina. The aponeurotic part of the internal oblique splits into two laminas, anterior lamina and the posterior lamina, and it entirely surrounds the rectus abdominis muscle. So at the first level above the costal margin, the anterior wall was formed by the rectus sheath. Anterior wall was formed by the rectus sheath, or the rectus abdominis was covered anteriorly, just anteriorly, by the rectus sheath, whereas the posterior wall was formed by the fifth, sixth, and seventh rib. At the second level, which is between the costal margin and pubic symphysis, the aponeurosis of internal oblique splits into two, the anterior lamina and the posterior lamina, posterior lamina, which completely surrounds the rectus, completely surrounding the rectus abdominis vessel. At that level between the costal margin and pubic symphysis, the aponeurotic part of the internal oblique is dividing into two, forming an anterior lamina and the posterior lamina, anterior lamina and the posterior lamina surrounding the rectus abdominis completely. Now the third level and the last level, which is the below the arcuate line. Yes, we now already know about the concept of the arcuate line. What is arcuate line? It is the site where the posterior lamina of the rectus sheath moves anteriorly or end is known as the arcuate line. It is one of the weakest point of the anterior abdominal wall and is an important surgical landmark for surgeon in case of splingillian hernia. Splingillian hernia, important surgery, and it has its importance too because it is the site where the inferior epigastric vessels pierces the rectus abdominis muscle. So at the level below the arcuate line, the posterior lamina has now moved forward. Posterior lamina has now moved forward, hence the rectus sheath is present only anteriorly. Present only anteriorly. So that was all about the concept of the rectus sheath. Now let's have a quick recap of all we have studied from the McClimber note. So now let's just have a quick recap about the topic that we have studied, rectus sheath. The diagrams attached here are taken from slides. So what was rectus sheath? It is a long fibrous envelope that encloses the rectus abdominis, and this fibrous envelope is formed by the aponeurosis of the three lateral muscles, external oblique, internal oblique and transverse abdominis. This rectus sheath has two walls, an anterior wall and then the posterior wall. The rectus sheath, as we know, is considered at three levels. The first level above the costal margin, the second level between the costal margin and the arcuate line, and the third level below the arcuate line. So above the costal margin, the rectus sheath is present only anteriorly, which is formed by the external oblique, and the posterior wall is formed by the fifth, sixth and seventh costal cartilages. At the second level, which is between the costal margin and arcuate line, the aponeurosis of internal oblique splits into two lamina and encloses the rectus abdominis completely. The interior wall being formed by the external oblique and internal oblique as well, and the posterior wall formed by the internal oblique as well as the transverse abdominis. The anterior lamina is forming the anterior wall, and the posterior lamina of internal oblique is forming the posterior wall. The last and the third level, which is the below the arcuate line, we are clear about the concept of the arcuate line. It is the side where the posterior lamina or the posterior lamina of internal oblique moves forward or end, and this side or indicates the arcuate line. This imaginary line where the posterior wall moves in the front is known as the arcuate line, and it has important landmark for surgeons. It is also the site where the inferior epigastric vessels enters the rectus sheath and is present between halfway between umbilicus and the pubic symphysis. So below the arcuate line, the anterior wall is formed by the aponeuroses of external oblique, internal oblique, and transverse abdominis, and the posterior wall is absent. Now, as you can observe here, the arcuate line. This is our arcuate line, and the inferior epigastric vessels are piercing the rectus abdominis here. This arcuate line indicates that the posterior lamina of the rectus sheath has ended and has moved anteriorly. Now, as you can see here, it is one of the best diagrams for the illustration. The first level, just below the costal mark. Now, let's observe this diagram. The xiphoid process and the pubic symphysis. Here is our rectus abdominis extending from the xiphoid process up to the pubic symphysis, having its tendinous intersections, the fibrous bands that are dividing the rectus abdominis into distinct segments. Are the 7 layers of the anterior abdominal wall. The first layer is skin, the second layer is superficial fascia, beneath it is our deep fascia, and then we have the muscular layer, and then we have the extraperitoneal fat and the parietal peritoneum. The inferior epigastric vessels piercing the rectus abdominis at the level of the arcuate line. So that concludes our lecture on rectus sheath. Oh, one of the important, what is the clinical relevance of the rectus sheath is the rectus sheath hematoma. Hematoma is the collection or pooling of blood within the rectus sheath, often below the level of umbilicus, and the most common source of bleeding is the inferior epigastric vein. The causes for the formation of hematoma are as blunt trauma or excessive stretching during pregnancy. The symptoms for it are midline abdominal pain and acute tender mass. So now it concludes our lecture on rectus sheath. Hope you are clear about it. The notes for this lecture would be available on the Instagram page of Med Climbers. Thank you.